what is the public health approach towards hearing loss and what WHO is doing in this regard. So just to briefly outline that the key messages which I'm going to be sharing, or the key aspects which I'll be sharing through this webinar today, are to highlight that hearing loss is a public health issue. It's a public health concern. As clinicians, we often see it in a clinical setting or in a clinical light, but what does it mean from a public health perspective is what I'm going to try and highlight. To show that, of course, you all know that unaddressed hearing loss has a high impact on individuals and on their families, but also that it poses a high cost for the society in terms of an economic cost, which is what we could highlight. Also to say that interventions to address hearing loss are cost effective, and action is required in order to make ear and hearing care accessible to all people. And then just to share with you, as I mentioned briefly, what WHO is doing in this and how it is trying to address this through a collaborative effort. So starting with that, just to first define the problem, well, millions of people live with what we call as the consequences of unaddressed hearing loss, and WHO estimates that there are 360 million people who have what we term as disabling hearing loss, which in audiometric terms means hearing loss greater than 40 decibels in the better hearing ear in adults, and in children that is 30 decibels in the better hearing ear. So it doesn't really take into account mild hearing losses or unilateral hearing loss. We also know that as many as up to 5 children out of 1,000 continue to be born deaf or with hearing loss. In the elderly, as many as 1 out of 3 older adults above the age of 65 have hearing loss. And another issue which is of concern, especially for WHO, is the continued high prevalence of ear infections, because as many as up to 330 million people across the world still continue to have ear infections which manifest as draining ears or discharging ears. What is also a concern is that this is a problem which is growing, and one of the reasons for this growth or potential growth is the demographic shift which is occurring in populations across the world as people are living longer with the improved medical care, improved health care, improved medical facilities. The number of people aged 65 is actually set to increase anywhere between 18 to 50% in different regions of the world in this one decade in which we are right now in. So between what it was at 2010 and 2020, there would be nearly 1/3 increase in the number of older adults living across the world. So with this increase, we also expect there to be an increase in the number of people who need access to hearing care. Then is also the issue of exposure to loud sounds. So occupational noise is accepted as a risk factor for hearing loss, but with the easy access to technology, what we estimate is that over 1 billion young people are at risk of hearing loss due to the way they are listening to music and the way they're exposed to loud sounds in recreational settings. Moreover, even the traditional causes, whether it's ear infections or congenital hearing loss or early acquired childhood hearing loss, the continued lack of access to hearing care services in the lower middle income countries still poses a great challenge in this respect. What makes hearing loss a public health issue is not just the high prevalence, but the fact that, well, it carries a high impact, an impact on the individual, certainly, and on their families in terms of communication, education, impact on their employment opportunities, which a person with hearing loss has, and social and emotional consequences for the individual and their families. And these are things which I think most of you are well aware of, so I won't go into the details. But just to say that what is important from the public health perspective is also that many of the causes which lead to hearing loss can be prevented through public health strategies. Those strategies include strategies such as immunization against rubella and meningitis, management of ear infections, control of ototoxicity, reduction of noise in occupational settings, in recreational settings. And it is estimated that in children, at least 60% of hearing loss is actually due to preventable causes. So causes which can either be prevented or causes which can potentially be treated, such as ear infections, in order to prevent the hearing loss that comes with it. And then when hearing loss does occur, we have, there are interventions available which can address it. So people who have hearing loss can achieve their full potential, or at least have the opportunity to achieve their full potential, through early identification, through use of appropriate hearing technology and rehabilitation, through education and empowerment. So the fact that hearing loss has a high prevalence, hearing loss carries a high impact, hearing loss can be prevented and can be treated, are all part of this public health dimension of hearing loss. And this is why, on behalf of WHO, I'm highlighting today the need for action on hearing loss as a public health concern. Despite knowing this, when we try to convey this information to policymakers or decision makers, we very often get from them, well, we may get a sympathetic ear, but oftentimes we get a question, which is to say that, well, what is the cost of not addressing hearing loss, and is it cost effective to provide interventions? And these questions relate to the fact that policymakers, decision makers need to allocate resources. They need to make sure that the resources are appropriately allocated, and if they have to allocate resources for one aspect, in this case, that being hearing loss, let's say, they may need to pull those resources out of certain other health agendas. So why should they prioritize hearing loss over other things? And this is a question, and these questions we asked ourselves in trying to address this issue to policymakers or decision makers. Why should we address hearing loss? Why can't we afford to ignore hearing loss? So in order to answer these questions, WHO undertook a study. So the first question being, well, what is the cost of not addressing hearing loss? And in order to answer this question, we partnered with some experts, obviously economists, health economists at the London School of Economics. Over these 2 years, 2015-16, they first started with reviewing a whole lot of publications with respect to the cost of hearing loss. And after reviewing nearly 450 studies, they included 50 studies which really focus on the cost associated with not taking action. So these were studies which don't talk about the costs of hearing aids or implants, but rather the costs of in action. And I'll explain that a bit more as we go along. Through this, well, we gained an understanding of what are the costs which are associated with hearing loss. What are the direct costs in terms of costs of providing healthcare services to people who have hearing loss, which is not addressed, the cost of educational support for children with unaddressed hearing loss, and then also indirect costs, which include costs of loss of productivity or inability to gain employment, and then also intangible costs, or what we term as societal costs, and I'll explain these a bit more as we go along. Subsequent to this review, our partners at the London School of Economics, the health economists, they undertook an analysis. And because, well, we really don't have an abundance of this data and information, so a very conservative analysis, which provides us with the first picture of what the global cost on hearing loss could look like. This analysis, well, is based on the prevalence, which is reported, the reported prevalence of hearing loss in different regions, and it focuses on 4 aspects: the burden on the healthcare system, which does not include, as I already mentioned, the cost of providing devices such as hearing aids or cochlear implants, the cost of educational support, the loss of productivity. What is the cost of that loss of employment? So the fact that people with hearing loss, if they are not gaining employment, what does that mean for country in terms of loss of productivity, loss of, taxes which people who are employed and earning could pay, etc. And then finally, the intangible or societal costs, which are really the most difficult to quantify, and how they were quantified was really by trying to put a dollar figure to the cost of not having hearing loss. So the rhetorical question there was that if you could avoid having hearing loss by paying for that, how much would you be willing to pay, is the kind of thinking which was behind estimating these societal costs. So based on this, we could estimate that the healthcare system costs, it varies between $67 to $107 billion. Loss of productivity is estimated annually. It costs the world $105 billion at least to not have people who have hearing loss in employment. Societal costs form the biggest chunk of it, and this amounts to $573 billion. And then the cost of additional educational support for children in mainstream education is estimated as $3.9 billion. And this does not include the cost of higher education, university education, etc. So putting all of these together, the report which we have just released shows that unaddressed hearing loss poses a global annual cost of about $750 billion. And the question is, okay, it carries a high dollar value, but what can be done about it? And that brings us to the second question. Well, if it carries a high cost, what can we do about it? Is it cost effective to provide interventions which can mitigate the adverse impact of hearing loss? In order to be able to answer this question, what we also did over 2016 in parallel with this study, which was going on, was to gather available evidence on cost effectiveness of interventions. So interventions which looked at preventing hearing loss, also early identification through screening programs, and provision of services. Well, we searched literature, and finally we could identify some studies which we included in the review, and we analyzed it to come up with the key messages in this regard, or the key conclusions in this regard. Overall, we found that most of the actions which were studied in literature with respect to hearing loss were reported to be cost effective. So in terms of prevention, we found that there were two actions which were highlighted or which had been studied, and one was the early management of otitis media, of discharging ear, which is shown to be highly cost effective intervention. The other aspect of prevention is the prevention of noise-induced hearing loss, which had been studied in a few studies. And what we found was that, well, most of them reported that this is cost-effective, and of course, it would lead to reduction in number of people with hearing loss if health resources could be directed towards raising awareness about noise and in noise, in hearing conservation programs in occupational settings, but also in a broader societal setting. In terms of early identification, well, there is ample evidence that screening programs, universal screening programs for infants and neonates are cost effective, as is screening for school children and screening of adults over the age of 50 years. What was important, or what was highlighted in many of these studies, was that one needs to establish a tracking system in the screening program in order to ensure that there is optimal benefit. We also studied then the cost benefit of hearing devices, that is the use of hearing aids and cochlear implants, and both of these are cost-effective interventions, where hearing aids, especially when they are used continuously, so that of course is something which needs to be ensured, that hearing aids are used rather than taken and not used, and their cost effectiveness is certainly better when they are accompanied by audiological rehabilitation, thereby making a case not just for provision of devices, but for provision of rehab services along with the devices. And then cochlear implants, which are really very cost effective, and most cost effective when used unilaterally and at an earlier age, but even when used at a later age and when used bilaterally, it is still cost effective. However, there were significant gaps in data, so significant gaps in terms of data from low and middle income countries, which is not easily available, data on education, and lots of missing segments. So, for example, we could not get data on what informal care and days lost for care providers. And also in terms of cost effectiveness, there is a lot more which we need to research in order to make, let's say, a better informed estimate than what we currently have about cost effectiveness. But the question is that, what does this all mean, in the sense that, yes, there is hearing loss has a high impact, hearing loss has a high cost, and it has, well, interventions are cost effective, but how can this, you could say, knowledge or awareness trickle down to the level where it is required? And the next step from a public health perspective to addressing the challenge of hearing loss is really to understanding what are the challenges and barriers which face us. So what is it that hampers access to ear and hearing care services to the people where they need them and when they need them? So the obvious challenge, of course, is the fact that the prevalence of hearing loss is potentially increasing, and we already discussed the reasons for this, so I won't go into it again. It's also a fact that human resources are um, really lacking in the world to address hearing loss and to provide hearing care. So whether we look at availability of otolaryngologists or audiologists, if we look at a few years back in 2014, as a matter of fact, we released a report called the Multi-Country Assessment of National Capacity for Hearing Care, and this report tried to assess what is the availability of human resources across the world in countries across the world. Um, the results were published on our website and in a document. But just to give you one aspect of it, when we look at the availability, let's say, of audiologists versus the prevalence of hearing loss. So the top map showing us here the prevalence of hearing loss, the darker shades being the darker, the more numbers of people with hearing loss of greater prevalence. And here, if we look at it, it's again the same. The darker colors are the more number of human resources available, and just at a glance we can see that there is a sort of inversion of colors, and places which have the most need have actually the least resources. We also tried to map out what is the available, how many countries have some sort of policy, some kind of legislation or strategy in place to address hearing loss. And overall, we found that there were 32 countries in the world which had any kind of national strategy or policy in place to address hearing loss. Another challenge that we really face is the misinformation and stigma which is associated with hearing loss. And people across the world continue to have various misperceptions about hearing loss and the fact that it can't, and the thinking that perhaps hearing loss cannot be treated, it's a curse, etc., etc. And this is certainly a barrier when we think of addressing hearing loss as a public health issue. So if I try to just kind of analyze and summarize all of the barriers and challenges that we have, or rather the barriers that we face, I find that I can pretty much put them in two kind of sections or two columns. The barrier of awareness, so low awareness about hearing loss amongst individuals, society as a whole, policymakers. And the second is lack of access to services. So, and contributing to this, of course, is the lack of human resources, the fact that interventions such as hearing aids and cochlear implants, no matter how cost effective we say they are, they carry a cost which has many a times to be paid out of pocket by individuals. And the fact that there is a lack of government policies is also the reason why there is lack of access to care in many of the places. So having analyzed the barriers in this way and thinking that it comes under two main headings, in order to address this as a public health issue, what we think, when I say we, I mean WHO thinks, is we need to kind of turn this thing around and try to address these two barriers. So, well, because there is lack of awareness, we need to increase awareness through evidence-based advocacy, which targets policymakers, also targets professionals like, well, you and me, and the community at large. And the second aspect of this is improve access to services. So how does one improve access to services? Well, first of all is to develop strategies for hearing care which are integrated within the country's healthcare system. So which are part of the healthcare system, whether the country is addressing, when it's addressing health of the elderly or health of, let's say, its workers or children or adolescents. hearing care should be a part of this. So we need to develop strategies or need to have strategies for hearing care which ensure that these services are provided to people at the different stages of the life course, you may say. Also develop human resources, because well, having a strategy is fine, but well, early identification can take place through a community effects. So trying to raise awareness through advocacy, advocacy about hearing loss and hearing care at all the different levels, like I said, with policymakers, with the community, with the professionals, etc. But also, the second part of this is to provide technical support to countries so that they can develop effective public health strategies for ear and hearing care, which can provide services to people where they need them and when they need them. So in this context, it's very important to understand that first of all, that advocacy is useful or important only when it translates into action at community level. Otherwise, advocacy for the sake of advocacy, of course, is kind of not so helpful. So advocacy for which translates into action, and then provide technical support so that countries can develop strategies for their own, which are relevant to their own situation. And when I say their own situation, I mean, of course, their own prevalence of hearing loss, the profile, what causes hearing loss in those countries, but also in the context of what are the resources they have, both human resources, financial resources, etc. So, and yes, sorry, when I forgot to mention that their existing health system. So it's very important that the services or the strategies which a country develops are right for that country. We cannot try and fit a strategy which has worked, let's say, in the UK into a country, let's say, like India. So, or any other country for that matter. So it has to be strategy which is apt for that country's own needs and in keeping with its own priorities and resources. In order to, for advocacy, when we talk about advocacy from WHO side, we are talking about political advocacy. So I don't know how much you know about the World Health Organization, but the World Health Organization, like the General Assembly of the United Nations, has a World Health Assembly, and the ministers and secretaries or policymakers of the health, of ministries of health of the 194 countries which are member states of WHO are part of this World Health Assembly. So every year they come together to discuss various health issues and to flag what is requires attention, and then well, they pass resolutions which draw attention to something and kind of list out what countries should do and what WHO should do. So we had a resolution on hearing loss in 1995, and now we have a new resolution which is proposed for 2017. So it should be coming up for discussion this May. And this resolution, which is passed by the countries themselves, is a very useful tool for political advocacy for countries to go to their own governments with and say that, well, you were part of the World Health Assembly, which adopted this resolution, if this resolution gets adopted, and then to use it in order to get countries to work, get their own ministries to work in this field. Advocacy also, as I said, targeted at other people, so through various documents, infographics, so information products and materials which we develop from time to time. Advocacy, also using WHO's media and communication channels to reach out to the world. So that is also a very important channel which is available to us, and we try to make use of that in order to get the message of hearing out. We've also developed certain global initiatives and campaigns over the last few years. So the World Hearing Day, which of course is tomorrow, is one such initiative. And over the last few years, we have been using different themes to draw attention to different aspects of hearing loss, and to kind of build up a case for investment in hearing loss. The second part of our work, in line with the two identified priority, is to provide technical support to countries. And this technical support again comes in two forms. So it comes in the form of documents of technical guidance. So documents which are like a situation analysis tool, a manual, a screening protocol, training manual, so various guidelines on hearing aids, etc. So different products which we develop, technical documents which we develop in order to support countries to develop, implement, and also monitor their strategies for hearing care. And we are in the process now of developing, over the next few years, a toolkit of comprehensive technical support which can assist countries in developing, implementing, and monitoring their national strategies. The other aspect of technical support is a more kind of hands-on or customized assistance which we provide to countries when they ask for it. So through regional meetings, we have meetings, we try to organize consultations of meetings in different parts of the world, in different regions. You know, WHO is divided into 6 regions. So across these regions, in order to get people, both professionals as well as ministerial delegates, to come and understand why hearing loss is important, what kind of strategies could work, what has worked in different parts of the world. So through regional meetings, and where countries request us for support, then at times through country visits and online support, we assist the countries in developing their own individual strategies, public health strategies, to provide ear and hearing care to their populations. Another initiative that I just want to mention with respect to WHO is our Make Listening Safe initiative, which is kind of a mix of both. So we are working on this initiative, and we are trying to work with standardization agencies to develop standards, so global standards for personal music players, etc., which are consistent with safe listening. To develop a health communication strategy in order to raise awareness about safe listening. We are also in the process of finalizing now, and we hope to launch in the coming couple of months a software application which will be like something you can, it's a media player which you could download, or anybody could download on their mobile device, smartphone, etc. And you could listen to music through it, and it would give you what is the dose of music that you have listened to for today, and is it within the safe limits or not, and how much did you exceed, or how much of listening time do you have left at this level, etc. And integrated with that, of course, we are putting in some health messages so that people can learn more about safe listening as well. We are also working at certain research aspects, looking at developing a screening protocol to have more consistency in studies which assess the impact of noise on hearing. In all of its work, WHO follows a collaborative approach, and we collaborate a lot with governments, of course, but also NGOs, with professional bodies, with academia, also user groups, and also manufacturers, in order to develop a global action on hearing loss. Because as I see it, WHO is one part of this global action, which consists of so many things: surgical care, medical care, provision of devices, rehabilitation, planning, advocacy. So in all of this, WHO has to play a role, but all the other stakeholders have an equal role to play in this global action. And each one of us, so while we talk here that there are decision makers need to play a role, but really they are a part of this entire global action as well. And each one of us actually needs to also play our own roles in highlighting concerns about hearing loss as a public health issue, and to develop a more of a public health orientation. Because when we work together, we can certainly work much better. So like it says here, I mean, we may consider ourselves to be little drops of water, but when we work together, we can have the power of the mighty ocean, the power of tsunami, and make a change. And the vision towards which we are working, and we hope that others, such as yourself, would join us in this vision, is that of a world in which no person experiences hearing loss due to preventable causes, and those who have hearing loss due to unavoidable reasons can achieve their full potential through rehabilitation, education, and empowerment. So thank you very much for joining in, and there are some links that you could access in order to gain more information about the report that I was mentioning and information on World Hearing Day. And of course, you're welcome to visit our site for any information on what WHO does. Thank you. Back to you, Jay. I can't hear you. Get your phones. Okay. Trying with our various advocacy materials, trying to make them very user-friendly and also visually appealing so that people can, kind of want to pick them up and try to use them and read through them to go into the text, but without. And if you go through our materials, I think we're certainly trying to portray hearing loss in a positive way, and the positive impact that interventions for hearing loss can have. But of course, this I'm just holding up one of the materials that we have for this year. But if you have any suggestions, we would really welcome that, and you're welcome to give us your suggestions as to how we can make our message more impactful while still keeping it positive. Any more questions? So, yeah. Do you have any ongoing collaborations with UK government on hearing care related? Perhaps we can help. Okay, yeah, sure. So we don't have like a formal collaboration with the UK government, but we are, in a sense, in touch with them. The NHS is organizing also an event, you may be aware, tomorrow. And we are in touch with them overall, and we believe that today also there was an event, no, not today, sorry, yesterday there was an event at the House of Lords for the World Hearing Day. Ultimately, what our effort is really to keep on doing advocacy in order to have people pay attention to this issue. And certainly in that is not something which WHO can do alone or do on its own. So for example, the event which was yesterday at the House of Lords was organized by a few organizations and institutions coming together. So some UK-based NGOs and along with the London School of Hygiene, etc., they organized this event. So I think it's extremely important for all partners, and professional bodies like the BSHAA are certainly a very key partner in this effort. So my thing would be that we need to write about the public health approach in your journals, on your website. Write about, share it also with your students at times, and with the younger generation, so that they develop, besides their clinical skills, which of course they must develop, they also develop a public health orientation towards it, looking at not just the clinical aspects of hearing loss. Of course, they are here to provide a service, but also from a larger public health perspective. So that is again something in which we really think that there is a lot to be done for us to have a more public health based approach towards hearing care overall globally. So I don't know if I've made that clear, but I'm happy to also, I realize that there are issues about the time, so I'm happy to also answer these questions. Yeah. Yes, you're right. So there is this observation. Okay. So what diagnostics would you recommend that a screening program should be based on to avoid high levels and false positives and negatives, and there really needs to be a strong link. Yeah, of course, what you're saying is absolutely right, but my purpose here right now is not to say what test is good in which situation. We already have certain recommendations from WHO, and if you read those recommendations, it's really about various types of tests and identifying what works best. So while we say that certain physiological tests are the best in certain situations, again, this is not a question I would really like to give an answer to, because there are so many aspects which would need to be kind of considered, and trying to say one name or to answer it in just half a minute would not be doing full justice to the question. So I'm happy to answer it in an email if you wish. Yeah. So Jess, that 40% is in high income country. Okay. Yeah, so the fact that the costs are more is because it's a reflection also of the economic development index of the country per se. So the fact that the cost is high in the high income countries doesn't mean that it's not there in the low income countries. If we look at it, because what we have here in the cost is it is based on what is the economic situation of the country. So for example, a productivity loss in a country which is a high income country would be more than the productivity losses in the low income countries. So and similar is the situation with societal costs. So if you look at it in detail, these are the two costs which are higher in high income countries, and that is because, well, there is the value of their currency is more, you could say, or wages are more, earnings are more in these countries. So obviously if you lose earnings, you tend to lose £1 in, let's say, in UK versus 10 rupees in India. So the difference is because of, not so much because of the fact that the problem is less, but because of the economic strength of the country. Does that, I hope it answers your question. I can't. Yeah. We will also, just to tell you, okay, so yeah, fine, we come to the end of this. And just to say that we have a seminar tomorrow in WHO from 12:30 to 2 WHO, so Geneva time, which is 11:30 to 1 your time. It's available for viewing over WebEx. And I don't know, Jay, if you have received the link from us. And if you have, you're welcome to share it with others, where we would have Dr. Matt Dade, who undertook this work and this analysis and developed this report, would also be available to explain some of the findings. Okay. So thank you very much.